this lecture, we will preview my next series of lectures focused on bipolar and related disorders found in the DSM-5 TR. Bipolar and related disorders are found between the chapters on schizophrenia spectrum and other psychotic disorders and depressive disorders in the DSM-5 TR. In recognition of their place as a bridge between those two diagnostic classes in terms of symptoms, family history, and the genetics, the diagnoses included in this section are bipolar 1 disorder, bipolar 2 disorder, substance medication-induced bipolar and related disorder, bipolar and related disorder due to another medical condition, other specific bipolar and related disorder, and unspecified bipolar and related disorder. Now, in the bipolar 1 disorder criteria, and by the way, that's my next lecture where I go more in depth in regards to bipolar 1. So it represents the modern understanding of the classic manic depressive disorder or affective psychosis described in the 19th century, differing from that classic description only to the extent that neither psychosis, not the lifetime experience of a major depressive episode, is a requirement. However, the vast majority of individuals whose symptoms meet the criteria also experience major depressive episodes during the course of their lives. And bipolar 2 disorder, requiring the lifetime experience of at least one major depressive episode and at least one hypomanic episode, but no history of mania, is no longer thought to be less severe condition than bipolar 1 disorder, largely because the burden of depression in bipolar 2 disorder and because the instability of mood experienced by individuals with bipolar 2 disorder is often accompanied by serious impairment in work and social functioning. The diagnosis of cyclothymic disorder is given to adults who experience at least 2 years for children in a full year of both hypomanic and depressive periods, without ever fulfilling the criteria for an episode of mania, hypomania, or major depression. A large number of substances of abuse, some prescribed medications, and several medical conditions can be associated with manic-like phenomena. This fact is recognized in the diagnoses of substance and/or medication-induced bipolar and related disorder, and bipolar and related disorder due to another medical condition. The recognition that there are individuals who experience bipolar-like phenomena with symptoms that do not meet the criteria for bipolar 1 or bipolar 2 is reflected in the availability of the other specific bipolar and related disorder category. Specific criteria for a disorder involving short duration hypomania are provided in Section 3 of the DSM-5 TR in the hope of encouraging further study of this presentation of bipolar disorder, symptoms, and its course. In my next lecture, we will go more in depth in regards to bipolar 1 disorder according to the DSM-5 TR.